One of the defining things about refugee communities is that they have two problems. There's a problem of the NCD they came with from wherever they were coming from. So if you take a Burundi, and if you take a Uganda, and if you take a Southern Sudan, so they have health issues from where they came from, and they have local issues from where they are now domiciled currently in the refugee camp. If you look at the journey of relief and rescue, the first few days and months and years of a refugee camp or arrival of an individual in a refugee camp, the authorities are more concerned with rescue. I mean, we are more concerned with issues about cholera, issues about malaria, then we start moving into other chronic but infectious diseases in nature, TB, HIV. So by the time a person with diabetes gets to have insulin, they probably have complications. They probably have had a lot of issues with their disease, or the local health workers are not even capacity built to deal with NCDs. They are more infectious disease, nutrition, injuries, crises, psychological treatment, rather than the chronic nature of diseases. You need to look at it economically. The cost of inaction versus the cost of action. That the cost of inaction is so big compared to the cost of action. We just know that it takes less than 10 shillings to screen a patient when you're looking at it at the public health level. And when you look back, that's very little money compared to how much anguish and burden you'd have saved a family or an individual or a community if you put those people on just a simple drug that controls their hypertension. Because it's easier to control a person with hypertension than to deal with a person with a stroke. So the downside of it is just too expensive and not sustainable. So I think the solution is, in as much as we are asking donor agencies to put in money, I think there's a big, big role of domestic financing. And for the UNHCR and for the refugee communities, of course, domestic financing means money from the refugee authorities, and also the country also puts in some money to support patients living with diabetes and other NCDs.